Hi, I'm Dr. Carolle. I'm a board-certified obstetrician and gynecologist, a fertility specialist, and I'm a fellow of the American College of Obstetrics and Gynecology. At this stage of my life, I decided to start helping women who are having difficulty getting pregnant. And I've gone through delivering thousands of babies, still delivered a baby recently in Haiti after a long time of doing that. And I help women, and doesn't matter what is happening to you and to your body. My gift, I'm also what it's called an intuitive, and where whatever it's happening to you, I can see it and able to give you the tools that you need to deal with it. I have an extensive knowledge in primary care, in women, and also I've helped some few good men, and especially if having difficulty in their relationships. And a friend called me not too long ago and said, you know what? You're an obstetrician gynecologist, you're certified, and you have all this information and intuition. I have some women who are having difficulty getting pregnant. He's from England, his mother is French, Dr. Williams, and then he said, Carolle, pronounced my name with this beautiful accent, and he said, you know what, I think we'll make a great team. He trained as a acupuncturist and traditional Chinese medicine, and also in Rhode Island, and he's also trained in San Diego, and also he did mindfulness training at Harvard. And I say, what he said is just like the people he was working, the women he's working with, the problem from traditional Chinese medicine, there are three things: the environment, and the physical body, and the emotion. They say you'll do perfectly with the emotions, and as an intuitive, and I've been able to finding out the root cause or what is causing the body to be responding to the stressors, and what is the stressors, and I said we'll make a perfect team. So, and that's what we started, and I'm saying then I need my team, and then you came to mind, Dr. Karen Bless, that I've known many years. We've worked together. We had a television show.
In fact, we started with me as your patient. That was a long time ago.
A long time ago.
It was awesome.
Yes.
Yeah. And then we just happened because of my profession. I'm a sex therapist, and I work with couples. And so we just reconnected after a period of time.
Yes.
And this has been fabulous.
Yes.
I just really have enjoyed working with you, and I love this new focus.
Yes.
That we've worked together on a number of things, but we haven't specifically worked with the fertility issue, even though both of us really have a lot of experience in this area.
Oh, of course.
You, of course, tremendous more, but I'm a registered nurse, as well as a psychotherapist, and having worked with couples for many years, and with these issues, as well as just general therapy issues, general couples relationship issues. So I know a lot about what makes for successful couples, and what helps couples be happy over a lifetime, as well as my specialization in sex therapy, which has a lot to do with then having babies. Ultimately, right? Besides enjoying sex throughout your lifetime, this is a particular period of time that's special to enjoy.
And then we're going to have a show, you and I, where we're going to talk about how to keep intimacy alive while we're going through fertility work. But the idea,
very important.
What we're going to be working with is that how do we make people understand how to prepare their body before even trying to conceive. What is the cause? Because if you see the statistics, 1 out of 6 couple cannot get pregnant.
Wow. And
about 40% is female, 40% is male, and 20% is unknown. And the patients I've worked with are those where they say, sorry, we cannot find anything. We can try IVF, we can try IUI, which intrauterine insemination, or in vitro fertilization, which costs thousands of dollars. And the hormones that they pump into you and all those things making your brain crazy and and the chances maybe 1 in 4 would get pregnant still. And then many times it's that. So what I've been doing over the phone, and people coming, this beautiful place here to be with, is to see why is it that you cannot get pregnant. And many times people know, unless they ask, why is it that you cannot get pregnant? It's whatever, something in the past.
Well, it's just not asked. And the thing is that couples that go through this, it's very stressful. This is not, going through IVF is not a simple thing. And there are stats that a certain number of couples end up divorcing because of the pain and the stress that it puts on the relationship.
Oh my God!
You know? I mean, it's a choice, but it's not as good a choice as working with us, working with you, going through the process of figuring out
what is it before you go through this. That's what we're offering.
It's an option, but but we got excited when we realized the possibility of really helping couples have some other choices, because we've seen it. Been there, done that.
Been there, done that.
Been there with people.
Yes.
And seen them go through the stuff and helping them through the stuff. But nevertheless, it's not an easy thing.
Yes. So the idea is just like, how do we help them? How do we say, whether you come over the phone with me, because it doesn't matter where you are, in French or Spanish, we'll do that. And then, but if you live in, especially for those who are here we live in beautiful San Diego, California, but people can come. It doesn't matter, because we're expecting people to come. So we'll have, one of the things we're going to do, we're going to have some retreats. So afternoon, or like a 2-hour retreats where they will come in this beautiful place that we have, just this beautiful garden that I created, and people have been coming for many different reasons, or for their health, for healing and finding the answers. And then we are saying, now we want to help the next generation. They don't have a nice grandma who said, I know, baby. Okay, why, baby? And then looking at them into their eyes and say, this is what happened. And then the stressor. And then many times, I remember I did my training at the University of Madison in Wisconsin for fertility. And I remember there was a patient, she came, by the time the person would come to the hospital, we were at the clinic, but by the time they're going to have surgery, is to find out why. And I remember when I'm doing the workup, and then it's just like something as simple, where when she was ovulating, her husband was out of town. And then also, or there'll be a woman, I'm trying to get pregnant, I cannot get pregnant, but she's married, and it's been 2 years. So after 1 year comes, the parents, the family, how come you're not getting pregnant? She's so stressed. She's so stressed that her periods start getting irregular. So if you're not ovulating, so this is the idea. What is the cause? What is causing you not to get pregnant? What are the tools that you need to guide you into relaxing, into knowing, and reviewing your questionnaire, reviewing. We created like 12-page questionnaires to go in depth. What is happening in your life? So that we could really be ready and make something very specific. Because I, too, have experienced couples who come in, and the level of stress that they're going through. Yes. And how many times have you heard couples that have tried so hard for so many years, they just say, forget it, we can't do it. And next thing you know, they're pregnant. Right? It's because they learned they just gave up, and they started relaxing, started having fun. And what we want to do is begin the fun in the beginning in terms of learning how to relax. And my focus is for couples to learn something that I don't think that a lot of people are focusing on, is really having a deep connected relationship. Yes. So many of our relationships are so superficial, and I think that it's easier to be torn apart if we really don't get in and really deepen our relationship. And situations like this can take us deeper, can take us more connected, and can help us grow, and things can be fun and beautiful instead of such a struggle. Yes.
You know?
And so that's why one of the things we're going to be doing with, we're lucky to have Reggie with us. We're going to be doing we're going to do these educational videos where we're going to teach as well. So we won't be able to accommodate everybody. So you can learn. So we're going to be starting doing specific topics where we're going to be educating and the tools and how to find things out. What is it? Where you are in Timbuktu, what do you need to know before you start mortgaging your home at thousands of dollars and putting stress in your relationship, and then to try to get pregnant when to know exactly what is going on. Is to give us an intuitive, it's just like, what is it, and I created, and you help in part of the relationship questionnaires in that. It's an extensive questionnaire,
right,
where we call it comprehensive and fancy questionnaire, where they can fill out on the internet and send to us beforehand, and where they can see. And the thing about it, I use it for different things for other patients, and it's just like, am I a fool or something? It's just like they realize it's creating it's go inside of you to understand what is going on. So we'll be doing the education.
So some of your patients, you've used this questionnaire for them.
Oh, but it's just like whether to make sense out of their lives.
Yeah,
so it's
and that's been very helpful.
Oh,
so you've
yes.
already had some good
I've been using it for
with that.
2003. 15 years.
Oh, well, that's true.
Yes.
When patients come to see me,
Mm-hmm.
I have some pretty good, not as extensive as this,
Yes.
but I have some really good questionnaires, and so I
Yes.
know a lot about people before
beforehand.
I even see them, and so it makes me much more effective.
That's
so
it.
I really love that process.
I do that because
Mm-hmm.
instead of you coming and say, okay, you have an hour, and then I'm going to start you all the question. It might take you 2-3 days to fill out those questions, and when you send it to me, I review it. So by the time you come to see me, or you are on the phone, we already know.
Right.
I already know. I can go, and I already know what is going on because of my gift
helpful.
as an intuitive, a medical intuitive, and knowing. And so by the time we come, it's just okay. This is the tool. This is what you're going to do, whether in person or over the phone. Or when we do our retreats, because people, we want to be putting hands on reclaiming your sexuality. So we want to do that. So we'll be doing retreats. So this is the beginning, and this is what we're going to be doing.
Well, and one of the things that was coming up for me was that I'm really good at working when couples come to see me. I'm really good at not taking sides and working with both people. So I want to remind us both that my husband is going to be joining us for some of the things. And we're really good at not only working with women, couples, but really including men in a way that both people feel very respected.
We're going to...
And it's very effective, and it really helps them connect with each other because they both feel like we're people who's on both of their sides.
Of course.
And really helping them.
And I'm not doing, now is the fertility, getting pregnant, but many times I see the women who come and tell me I'm having this problem, I have anxiety, and this like that, and whatever. And then to find out they have a wonderful man in their lives, I say, you're a witch. You are a witch. You're the one. You're so lucky to have this man with you. You might have chosen to be in this world, in this life, to be with this person. And then guess what? If you don't learn the lessons, you're going to reincarnate. He won't be there. So you better. And then they know, oh my God. And then sometimes too, if the wife will say, could you have a session with my husband? Of course, I will do that, and I will be able to guide them as well. So essentially, we do. It's a whole package when you come and work with us, whether it's going to be talking with you, talking to your husband, because we will be doing, we have this beautiful place here where we'll be doing maybe one day which is for couples, because maybe we'll have 15 couples. So, because I heard there's nothing for men. There's nothing for men. Right. With the loving understanding, no sides, we don't take any sides, because this is what's happening, and then we're there for you. The thing is, your goal is to have a baby. Your goal, and is to hopefully we can have that baby, and then also to know, when do I stop? Because we will uncover what's happening and say, don't waste your money, just waste your time, because we'll give you all the tools you need to get pregnant. Not only that, to carry it to be able to carry it to term. Not just what they call a chemical pregnancy, like a pregnancy test is positive and would, so this is the goal, and I am excited that I'm going to have so many women and so many couples in.
Well, I was just, one of the pictures that came in my mind as you were talking was this wall of pictures of babies. Well, you already have that at your office.
Yes.
But that would be very cool to,
we see,
this process.
Oh, you can see, we just have glass. I happen to be in the place where there were no walls. Oh. You can see just glass. You're looking exterior. But that will be, it's just like I am excited to use all these decades of knowledge and being able to see, and the thing is about it, people know when they are there, when they are with me or they're over the phone or in person, that they know they're in good hands. They know I listen, because I just ask. I say, why don't you get pregnant? Why is your period irregular? Why you want to sleep with this man? What's going on? And they tell you. It's so simple. People say, do you work hard? I say, no, I ask the person. They know. They usually know. So it's fun. So thank you for watching. And if you need any more information, you go to drcarolle.com, drcarolle.com, or mytruehealing.com. And you can send an email, drcarolle@cost.net. And we have Dr. Karen. I call you Dr. Karen Glass.
Yes, uh-huh. And my website is drkarengles.com, KarenGless. That's drkarengles.com.
And we hope to see you. We hope to go to our website, go to claiming your fertility. Claiming your fertility, because that's what we want. We want
Reclaiming.
So it's claiming it, because claiming it. That's right. It's just you didn't lose it. We want you to claim it. You just say, okay, this is why, and we'll guide you and how to do it while you're having fun, right?
That's right.
And then so
fun's the important part, right?
And that's why we're going to have a show as well, where you and I will be talking about how to keep intimacy alive. So stay tuned and watch. And Dr. Carolle, so I'm so glad that we're having this time together. And then until next time.
Until next time.